welcome to Mad Medicine with Miss P. I have to post a retraction. I'm the retractor from last week. Okay, so learned all about atrial tach. Yep, had no idea. When someone said it, and I was like, okay, so what does that mean? The atriums just, fire wildly and consistently and correctly, just faster than the rest. It doesn't go through. It doesn't. Yes, exactly. That's exactly what happens. Totally interesting. And this is how weird it is. Every time something bizarre like that comes up, and even if it's something I've never heard of like that, I've never heard of that. So like last week I was like, really? Is that a thing? Yeah, it's a thing. So not only does something like that come up, but then it comes up again and again. This has happened to me. I can't even tell you how many times. Like, if you've never heard of a specific lab value, and then it's elevated, you find out what it is and what it means. It's really interesting. And then like your next 10 patients have one. So talking to this lady the other day, and I believe she was a nurse because she used specific terms and she knew what she was talking about. So I'm pretty sure she was a nurse, but she was like, yeah, I had ATAC and then I had to do an AV ablation and stuff. And I was like, oh my gosh, that makes perfect sense. And then my coworker, whose boyfriend works in that specific field, like electrophysiotherapy or something like that. It's like Chandler's job. She's told me like 3 times. I still don't entirely understand what she does, but he does. But it was really interesting, and he kind of sent her a little text message and explained it all, and it made really good sense. And I was like, oh my gosh, how have I been in nursing 30 years and never heard of it? So cool, you learn something new every day. Anyway, that's that. Just wanted to update you. So the past couple weeks or so, I got another fun list of fabulous things. I should write these out, but you should be able to hear them to an extent. One patient told me that they are going to a urinologist. That's the study of urine. All right, I know what they mean, urologist, but still cute. And then another patient, 2 separate patients. One wrote in that they're allergic to phenol. And I'm like, phenol, I'm pretty sure that's like a skincare acidic product, and it gives her skin abrasions. Well, it's acid, so it should. Yesterday we got a patient that said she's allergic to glycolic. It causes a rash on her skin. You mean like glycolic acid? Because those are both acids, and that's what they do. Maybe there's a different form of them. I don't know. But if you mean like you had a glycolic skin peel and it peeled your skin, that's what it's supposed to do. But okay. Oh, a patient was coming in for bunting surgery. Bunting surgery. Maybe it has to do with cakes. I'm not sure. Loristan. They mean losartan, but still, Loristan is what they were. So one of those stupid Japanese beetles flying around, banging into the light, distracting me. Loristan, that's maybe a character from South Park. And then colostomy, but I said, they're like, well, I had a colostomy. I was like, okay, did you have a colostomy or, no. I said like a bag on your abdomen. No, I had the colon inspection. In their defense, a colonoscopy is in fact a colon inspection. I'll take that. I think that's very creative. Oh yes, this was precious. I think my new coworker just started working here, and a patient, I don't know, did she tell me? I think she told me, and the patient told me, and she could like overhear because the headset's loud if you're not on the phone. And we have to ask if you have a pacemaker, is it on your, right or left side of your chest? And she goes, well, if I'm facing front, it's on my left. What could she possibly mean by that? If I'm facing the front of what? Your house? Your left is your left no matter which way you're facing. And for those of you having surgery and you're like, oh, they're working on my left arm, my left arm. Yes, it's your left arm. And guess what? Same side as my left arm. Left is left and right is right. I can't. And there was like, oh no, it's on my left arm side. Oh, your left arm side. Okay, yeah. Yeah, that's still your left side. And you're like, well, if you're facing me, it's my right. No, it's your left. It's always your left. It's not, I'm not the one having surgery. That's one of those I'm never, but if she's facing front, the pacemaker's on her left side. What could she have been? I don't know. That's precious. Okay. Yeah, and then like, as we're instructing these patients on what medications to take, I'll say like, take this, but not that. The morning of surgery, make sure you take this. Don't take these medications for 24 hours before your procedure. Like, well, I just won't take anything. No, that's not what I said. The anesthesiologist wants you to take these medications. Well, Dr. So-and-so, which is the surgeon, said, that I don't need to take this or this. I'm like, lady, I'm going to tell you one last time. I am calling for the anesthesiologist, the person that's putting you to sleep. The surgeon really pretty much only cares about aspirin so you don't bleed to death. That's it. All the other medications, he doesn't care, but aspirin containing products are the ones that he's going to care about. The surgeon is the one that needs your blood pressure and heart rate under control. So take your friggin' Carvedilol in the morning like I'm telling you. Well, I just won't take anything. Okay, we'll just chase your heart rate and blood pressure. That sounds like a great idea. Okay, or you can listen to the anesthesiologist's orders, but whatever you think. Oh, a bunionette surgery, not to be confused with the bunting. Yes, no meds listed, and we get this all the time. There was no meds listed at all, and then upon speaking to the patient, he ends up that he's on 6, and then that same question, when's the last time you had aspirin? And he says no, metformin. That's not what that's not related. If we want to know when the last time you had an aspirin containing product is, and you write no metformin, surely you understand they're not related. They're not related at all. Oh, and then I'm sure this was a typo, but still funny. They put in their emergency contact, and under relationship to patient, they wrote Beyonce. You think they meant fiance? Almost the same thing. And then bariatric surgery. They had some bariatric surgery to control the Barrett trees. Yes, what's the doctor going to do for you? Oh, he's going to shave off the arthritis. Shave it off? He's going to shave off arthritis? Okay, I feel like I had that one in here before because it was one of my favorites. Laparoscopy. Patient had a history of laparoscopimies, for the abdomen. They also think that's going into a joint, but that's okay. Morphine sulfur is an allergic to the morphine sulfur, ER. Septoplastic, that was their previous surgery. They had a septoplastic. All right. This is one of my favorites. Now listen, I keep a very open mind about everything. And I think this may have been on one previously, but when this patient says that my crystals have come loose, I'm assuming he means electrolytes, because I had one earlier a while back. Maybe, I don't think it was last week, but this is kind of familiar, so I don't think it was a repeat. Sometimes I can't understand my writing, so I rewrite it, but my crystals have come loose. I don't know if he means shiny small rocks or his electrolytes, but either way, I hope they get back in alignment before your general anesthetic. Oh, and did I tell you about this amlodipine? Is this a rerun? I feel like I talked about this last time, or maybe I reviewed this just before. I don't know. Amlodipine, a patient told me that they took it twice a week, and I was like, that's not really how blood pressure medications work. Twice a week isn't going to really get you there until you read the half-life. And let me tell you, the half-life of amlodipine is between 30 and 50 hours, so technically you can kind of take it 2 to 3 times a week and it'll still do the job, which I thought was really interesting. And again, didn't know that about amlodipine. Learning something new every day. You gotta love it. Now this one I didn't entirely understand. He said that he had mentations, dental implants under local. Mentations? I'm not sure. Oh, no, I know what it is. Okay, so he was talking about having, whatever the mentations are under local. But upon asking her, and this was a female, upon asking her, she said, now remember, your local, your dental implant under local, not nearly as important as your general anesthetic surgeries, but her exact words were, well, I had a breast aug also, but I didn't think that was relevant. Your general anesthetic procedure that took, probably at least 2 hours, and now you have a synthetic foreign body inside your chest, you didn't think was as important as your local dental procedure to mention in your previous surgeries? I don't know what to do with that. All right. The doctor says, I have a black hole in my eye. What are you having done? This patient's having a vitrectomy, and I already know that, but we always have to ask them because they have no idea why, and plus, how else are you going to get this fabulous information? The doctor says I have a black hole in my eye. All right, have you contacted a physicist and let them know that people would want to know that, I'm assuming, a black hole in your eye? And in the box, what do they write? Take care of me. That's original. Take care of me. Okay, that's what we're going to do. That's like the only reason you're here, so we can take care of you. But thanks for bringing it up. Oh yes, and under surgery, this patient wrote men's surgery. You know, the surgery for the men. Like, are we talking like prostatectomy, penile implant? Like, I have no idea what men's surgery is, but good stuff. Yes, and the reason that the patient was having their vitrectomy was visions. They're having visions, and we're going to fix that by correcting the black hole in the eye, I guess. I don't know. Yes, the patient was coming in to have a cataract surgery, and she felt it very important to mention that she's got a current nail fungus. Well, as long as you don't put that fungus in your eye, I think you're going to be okay. But I just want to let you know that I have a nail fungus. Yeah, we all do. I bet you don't know that. But yeah, look harder. We all do. Yeah, and here's the thing. We still can't figure this out. When family and friends leave messages for their loved ones, can you not leave your name and information? Because we don't care. I don't care about your name or your phone number. I'm not talking to you. We need to talk to the patient. Now, if you are an interpreter or your family member has dementia or they're a child, that's different. But when, like, if you're calling to help a friend or you're an overbearing spouse, I don't care what your name is. So when you're like, this is so-and-so, and I'm like writing it down and start looking for the chart, and you're not a patient, don't do that. We don't care what your name or your date of birth is. That's not, you're not a patient here. So we have to talk to the patient. That's the law, FYI. Amoxil makes her homicidal. Okay. All right. I would be very careful giving her any antibiotic if amoxicillin makes her homicidal. That was one of my all-time favorites. Mild metal valve and past. I think that was under special instructions or additional concerns. Mild metal valve in past. What could that possibly mean? You would think that she had a valve replacement, right? Nope, that's not what that was. I still don't entirely understand. Patient wrote in their cardiac history that something I ate threw me into AFib. What in the hell can you eat that could throw you into atrial fibrillation? What? Listen, open mind. Maybe it's entirely possible, but I'm going to need to see the size of that pepper or poison. I don't know. I can't imagine. A nasal septoplasty, which is always my favorite because that's where your septoplasty. I mean, I guess you can have a cardiac septoplasty, but that would probably be much more involved. My MD said that, and oh yes, that was a doctor. Yes, a doctor wrote in that he was having a nasal septoplasty. I guess there's other symptoms. Maybe I just don't know. A patient takes Trilogy. That was a medication. I'm sure they mean Trelegy, but I was looking for 3 other meds that this person took under that. Type of anesthesia, full. What kind of anesthesia did you have? Full. I'm having full anesthesia. Oh, the full anesthesia. I see. Metropolis, 50 milligrams PRN. Metropolis. Like, I joke about that. They straight up wrote it. Metropolis, 50 milligrams PRN. Not kidding. And a gallbladder is the other surgery that patient was having. The old gallbladder. All right, that's cool. I'm sure that's a thing in probably another country, but not here. So that's that, and I'll have to write up a new list and bring it for next week, or maybe I'll just skip next week because it's been a little busy here. So face your fears, forget your failures, follow your faith.